Could you give me a case example that describes the techniques that you're discussing in this article?
So yes, I think it's a great case because it's not like it was particularly difficult to recanalize these arteries, but it was very important to understand what was what. So this is a case that you can see very well here. There's a pretty obvious foot attack. Essentially, there's a second toe which is necrotic and infected, and you can see also that the infection spreads to the forefoot. And this patient, as any other patient of our centers, go to duplex ultrasound, and the duplex ultrasound was pretty clear. It was saying that the anterior tibial and the peroneal had a triphasic flow to the distal level. So triphasic means perfect. So if you have already two vessels going down to the foot, and one is the anterior tibial artery, which following the angiosome concept is the one giving flow to the second toe, I think you're pretty okay. And the PTA, so the posterior tibial artery, has just closer to 50% stenosis, but patent to the distal with strong pulsatile signals. So essentially, this is a pretty healthy foot. This patient was 57, so essentially you can say, we can go for an amputation, and we decided to go for an amputation, and this was the result. After 1 week to 10 days, there was no improvement at all, and actually I would say that the wound was open with no granulation, and the foot was at risk. So essentially, I pushed to go over the duplex, let's say, and to do an angiogram. You can see here, this is the angiogram. You can see the lateral view on your left side. And on the right side, there's anterior-posterior view of the foot. Now, I can understand that for some people it could be a bit difficult to visualize vessels, so I will use colors in order to let you understanding what the anatomy is here. So, if you look at the left side of the screen, as I said, the lateral view, you can see the anterior tibial artery. And the anterior tibial artery is going straight down to the foot arch, am I right? But look at the anteroposterior view of the foot. You can see that the anterior tibial artery doesn't go anywhere towards the foot arch because the anterior tibial artery should have gone roughly here. But here, we don't have any flow going down to the foot arch. And we can see that the posterior tibial artery, it's here on the left side of the screen with of course, the purple line, and here again. And the posterior tibial artery gives two branches. One is the medial plantar artery, which you can see here. It's always the one on the top of the bifurcation on the lateral view. And it gives this branch, which is still the medial plantar artery in the anteroposterior view of the foot, which gives very good flow to the first toe. And that's it. And then you can see there's only a thread-like collateral. You can see the two lines coming together on both projections, which gives flow to this vessel. This vessel is the lateral plantar artery. And this lateral plantar artery is the one which gives flow to all the toes. In this case, it's what is called a plantar dominance, which means that the whole flow is brought to the foot arch by a missing lateral plantar artery. And the missing lateral plantar artery is seen here on the screen. So our revascularization effort should be to connect point A to point B in order to give direct flow to the foot, direct flow to the wound, and to heal and save this foot. So what it was done, of course, the evaluation of the anatomy always need to be in our mind, but it's not just defining the variation, just to understand the direct path to our foot. So essentially, this was done with a long sheath, with the Armada XT balloon from Abbott, and then I pushed my O14 command wire into the lateral plantar artery. This is where essentially I land at the level of the wound zone target artery. I did an angioplasty with a 2mm balloon. And you can see here, this is before, and this is after. And it's cool to see, the two images on the lateral view, but it's also even cooler to see them on the anteroposterior view of the foot, because you can see now that this wound is finally reperfused by a reconstituted lateral plantar artery. And you can see here now the blush at the level of the wound. And despite I'm an interventional radiologist, I always like to show images of the foot. Of course, I'm making a joke here. And here we have the foot as it started, as you have seen before. And this is the progression of the foot granulating better and better until complete healing. So this is the case. Actually, the case just proves that you need to study the anatomy of every single patient in two projections in order to understand what's more convenient for that clinical scenario. And once you've done that, finally, you can act, and then you can do your best in order to, of course, provide a better flow to the patient.
Such a great case. I learned so much from your cases. Thank you for posting them and sharing them and talking through them like I'm a fifth grader. I really appreciate that. It's super fantastic. It helps.
No, but I think, there are many people, Ryan, that's, probably are passionate, but it's difficult to find actually someone who teaches you all the anatomy in little details. Because, I mean, the few people who understand, they sometimes talk between each other. They know the stuff that you're talking about, and don't consider that someone like me, when I started my business, vascular business, I mean, you can't talk about business in Europe, but let's say in a in a scientific way about critical limb ischemia patient, I knew nothing, and I had to go around and try to check, ask, and I had to get all the information from different sources, and sometimes it was difficult to access. Now, with this kind of new methods, like BackTable is a great tool. I mean, all this connection should be very fruitful. People should have more possibility to access this material. And, the more I can share and the more I learn from stuff that other people share, the better it is. So thanks for
and thanks, Dr. Patrone, for teaching us about this important concept.